Hello everyone, and welcome to the Gold Medal Caregiver channel. Do you know anyone who has a cough that just won't go away? A cough so bad they can't breathe? Be aware of the hidden danger of pulmonary edema. Today we're going to talk about how to care for someone with this condition. Gold Medal Caregiver will teach you everything from Western medicine to traditional Chinese medicine, and even some cool magnet tricks. Learn these all-around care secrets now. Recently, Aunt Zhang has been feeling like a rock is pressing on her chest when she breathes. At night, she lies down and coughs non-stop. After a checkup, she found out it was pulmonary edema. This water in the lungs situation is actually quite common and could be happening silently to someone around you. Today, we'll explain in simple terms. Why does fluid build up in the lungs? How does Western medicine treat it? And how does traditional Chinese medicine nourish the body to deal with it? We'll even share some ancient magnet therapy tricks. We've got it all covered for you, so get ready for some really useful information. First, pulmonary edema isn't really water. Western medicine reveals the three main culprits. The doctor said I have pulmonary edema. Does that mean I drank too much water? Don't get it wrong, this is a common misunderstanding. Pulmonary edema is actually tissue fluid in the wrong place, not the water you drink directly flooding your lungs. Let's look at the three common leakage culprits. 1. Heart failure causes a flood. If the heart isn't pumping blood effectively, especially in left-sided heart failure, the blood backs up into the lungs like a traffic jam on the highway. The increased pressure forces fluid into the air sacs. People with this often have swollen legs and get short of breath easily, like their body is experiencing a flood. Western medicine uses ultrasound to check the heart's ejection fraction to see if a lazy heart is the cause. 2. Pneumonia triggers inflammatory leakage. When bacteria or viruses attack the air sacs, the inflammation is like a broken pipe. The tiny blood vessels become leaky and tissue fluid seeps in, blocking the airways. You might have a fever and cough up yellow mucus. An X-ray shows white fog in the lungs. In severe cases, you might even hear gurgling sounds in the lungs, which doctors call rales. 3. Kidney failure leads to wastewater overflow. The kidneys are the body's drainage system. If they fail, water can't be removed and might back up into the lungs. People with this often have foamy urine and swelling all over their body. A blood test will show high creatinine levels, a sign the kidneys are crying for help. This situation not only causes pulmonary edema but can also damage the heart. 3 emergency treatments in Western medicine, simple and practical. Sit up, feet down. This reduces blood flow back to the lungs like slightly turning down a faucet. Diuretics for immediate relief. Medications like furosemide act like a pump, helping to remove excess water. Intubation for drainage. If the flood is really bad, doctors will use a tube to drain the fluid. The results are surprisingly fast. However, these are just emergency measures to relieve symptoms, not to cure the underlying cause of pulmonary edema. Second, traditional Chinese medicine says the lungs govern water distribution. The root of the problem is an imbalance of yin and yang, leading to disharmony of lung qi. Our ancestors figured this out long ago. TCM believes that the lungs are responsible for moving water throughout the body. Pulmonary edema is considered a phlegm fluid disorder, stemming from an imbalance among the lung, spleen, and kidney trio. Don't worry, I'll break down these 3 situations for you. 1. Lung qi deficiency. The defensive wall has crumbled. TCM describes the lungs as a canopy protecting the body. Lung qi deficiency means weak immunity, allowing external invaders like germs and cold air to enter easily. People with this type often catch colds, have a weak cough, and a white tongue coating. Yu Ping Feng San can be used to boost qi, like reinforcing a wall with steel bars. You can also add some astragalus root and chicken soup for warmth. 2. Spleen dampness obstruction, internal sludge buildup. The spleen is the body's water filter. A weak spleen and stomach can't transport water effectively, leading to sticky dampness and phlegm that blocks the airways. People with this often feel bloated, have sticky stools, and even have trouble putting on shoes because of swollen feet. Try Chen Tang with barley porridge to clear out the sludge and reduce swelling. 3. Kidney yang deficiency. The furnace has gone out. Kidney yang is like the body's furnace. When the fire isn't strong enough, fluids stagnate like frozen water. People with this are especially sensitive to cold, have sore lower backs and knees, and feel like they've run a marathon. TCM uses Zhen Wu Tang combined with moxibustion at the Mingmen acupoint, located in the lower back. to rekindle the fire and evaporate the dampness. TCM lifestyle tips. Drink some astragalus and goji berry tea in the morning to boost yang qi, refresh your mind and warm your body. Have a bowl of black fungus and lotus seed soup in the evening to nourish yin and moisten the lungs, promoting relaxation before bed. Before sleep, massage the Taiyuan acupoint, located on the wrist crease near the thumb, for 3 minutes to clear the lung meridian. Third, magnet therapy isn't magic. Ancient wisdom has a scientific basis. Benkao Gangmu states that magnets can nourish the kidneys and strengthen bone qi. Sounds amazing, right? Modern science has also discovered that magnetic fields can influence blood circulation and fluid flow. Magnets offer 3 particularly useful techniques for dealing with pulmonary edema. 1. Magnet acupoint stimulation. Apply magnetic discs with a strength of 800 Gauss or less to these key points. Shanzhong acupoint, center of the chest between the nipples, clears qi in the upper body, making breathing easier. Faishu acupoint, beside the 3rd thoracic vertebra on the back, below the shoulder blade, directly targets the lungs, doubling the therapeutic effect. Fenglong acupoint, outer side of the lower leg, slightly above the midpoint, specializes in treating phlegm and dampness, a true phlegm-clearing marvel. Reminder, magnets should be applied continuously for 24 hours, and you'll feel the effects within 3 days. 2. Magnetized water therapy. Place water in a 2000 Gauss magnetic field for 6 hours. This makes the water molecules smaller, easier for cells to absorb, and helps flush out waste. Scientists say this type of water boosts metabolism, and is especially good for people with edema. Use a medical-grade magnetizing cup for safety. Don't just DIY with any magnet. 1. Magnetic pulse breathing training. Some high-tech magnetic therapy devices emit pulses that match your breathing rhythm. This helps relax the intercostal muscles, the muscles between your ribs, and increases blood oxygen levels. This method is especially suitable for post-treatment recovery. Lie down and use it for 20 minutes, and you'll feel your lungs relax. 4. Combining Western and traditional Chinese medicine. 5 golden rules for daily care. Want to keep pulmonary edema away? These 5 tips are simple and effective. There's a formula for daily water intake. Yesterday's urine output plus 500 milliliters. Use a measuring cup to get it right. Don't flood your lungs by drinking too much water with good intentions. Western pursed lip breathing. Breathe out slowly like you're whistling. This helps the air sacs exchange more fresh air. Chinese 6. Healing sounds. Sigh sound. Make the sigh sound while exhaling to clear lung turbidity. Practice for 5 minutes daily. Elevate your upper body 30 degrees while sleeping, but remember to put a small pillow under your lower back and hips. Otherwise, your waist will be unsupported, causing strain and affecting circulation. Red light. Avoid cured meats and soda, they worsen edema. Yellow light. Limit soy milk and coconut milk to avoid bloating. Green light. Have more winter melon soup and carp soup, they're diuretic and nourishing. TCM says sadness harms the lungs. Laugh 3 times a day, even a fake laugh works, to expand the air sacs. Or play some shang tone music, associated with metal in the 5 elements, to nourish lung qi while listening. Don't ignore your body's SOS signals. See a doctor within 24 hours if you experience any of these. Waking up at night coughing, and only able to breathe while sitting up, orthopnea. Purple fingernails or lips, severely low blood oxygen. Coughing up pink, frothy sputum, acute pulmonary edema warning. It's recommended to self-assess your pulmonary edema risk every 3 months. Press on the front of your shin bone. Does the indentation remain for more than 5 seconds? Has your weight suddenly increased by 4 pounds in 3 days? Do you get out of breath climbing 10 steps? If you have 2 or more of these signs, don't wait. Go to the hospital for a checkup. Pulmonary edema is like a flood warning from your body. Whether you choose Western medicine to remove the fluid, traditional Chinese medicine to balance your body, or try magnet therapy, the key is to find the source of the leak. Save this video to your phone. Next time you see your doctor, discuss these options to create a personalized anti-edema plan. Let your lungs breathe easily and enjoy a more energetic life. Alright, Gold Medal Caregiver is signing off. Remember to subscribe, like, save, and turn on notifications. See you next time.